So it is a matter of mindset and it is a matter of practice. You need to, tune yourself and fine tune every day to see that how you are becoming more and more cost competitive. And when I say mindset, I mean it is a continuous journey. So it is not that once you do or undertake an exercise, you can achieve your journey. You have to work relentlessly to find out new ways and new means to achieve this goal. And as a result of that, it is going to be fruitful exercise. It may tire someone in between, but that should not be the roadblocker. Hinduja Hospital in its 68th year of operation, and from the beginning, it remains as a responsible healthcare provider not only in Mumbai but in the country. And when we see the kind of challenges, the kind of sustainability issues are coming across the globe, we felt and we realized it is a time for us also to contribute significantly in the journey of making our world livable for the next generation and subsequent generation. So what we did, it is not that something we started very recently. For a long time we have solar panels, we have other methods of restoring water, rainwater harvesting, all these initiatives. When we saw there is a credible accreditation certification process is in place, we just joined that, and that helped us. Our long history experience that has helped us in terms of achieving the green certification immediately. The other hospitals, according to me, they need to see that anything and everything they do, what kind of carbon footprint, what kind of contribution they are making to make this planet more greener, to make more livable, to make more friendly for the coming generations. So whether they are procuring items, they need to see that is not creating any kind of pollution. When they maintain their facility, they procure even the light fittings, and whether they are having some sorts of chemicals, painting, colors used in the hospital, in every aspect they need to see that how they can contribute, and that is something what they need to look into to ensure they are also in the same journey. Digitization is not necessary only for the big chain hospitals, it is needed for each and every healthcare provider, for a simple reason that unlike earlier when we had so much of traditional or legacy practices which were accepted by the patients, at the same time the efficiencies were not questioned. But if you look at efficiency, if you look at the outcome where a doctor need to take a decision on the basis of multiple inputs, whether it is diagnostics, other consultants inputs, when you need to have all this, you need to have cross sectional information, you need to have information from a particular disease group, you need to have the digital applications in place. Otherwise what will happen, it will increase unnecessarily the healthcare cost, it will increase unnecessary the inefficiency in the healthcare delivery system, which ultimately will make the healthcare costly for the patients. And today when we talk about making healthcare affordable, we cannot simultaneously work in the other direction. So that is the reason the digital needs to be adopted by the hospitals. When you look at the healthcare delivery pyramid and the professionals, at the bottommost we have the staff who are delivering healthcare, and at the top we have the limited number of doctors who are primarily delivering care. But if you look at this pyramid, it is not very balanced today, because the kind of qualified paramedical staff who are supposed to support the nursing and doctors, they are very less available in number. And secondly, the quality, the education what they have, that may not be adequate in certain places. So keeping that in the mind, way back around 10 years back, Hinduja Hospital started Allied Health Science program, and we every year we take one or two course we add along with whatever we had prior, and as a result of that, depending upon the demand and supply scenario in the market, we continue to increase. And as a result of that, today we have 12 courses in our hospital where we have limited seats, and those students, they undergo program for a year, and after they undergo for the program, then they really come out as a very trained professional, and they are demanded very highly in the hospital market. Now, why these two courses very recently we have added? It is not that we have added because of there was something special about this specialty, but every year we want to add because in the existing infrastructure we want to check and run whatever we can do, and then we realize these are two courses which are necessity of the need of the market, required by the doctors, required by the hospitals, then we have adapted. When you want to deliver high quality patient care, you need to adopt, you need to procure certain technology, you need to have certain practices which costs your patients. Now patients are knowledgeable, and slowly they are becoming very aware and demanding, and when they are coming, those informed segment of population, they question about everything. Now it is not bad that they are questioning, but during the course of that, I feel the kind of trust between a patient and a doctor, what was there earlier, that is getting lost. So that kind of, the feeling, the kind of attitude towards each other is changing. The second thing what I feel, what is necessary and challenge, it is related to, in my hospital, the infrastructure. The demand for our hospital infrastructure is so high, I may not be able to meet each and every time every patient request, and that made me to tell maybe at the end of the day sorry to some patients who are knocking our door for the healthcare, and that makes us to feel bad. But we are in the process of expanding our beds and expanding our facility, and hopefully that will take care of these additional requirements.